So, good day everyone. Our written demonstration for today is about obtaining an electrocardiogram. So, let's start first by defining what is ECG or electrocardiogram. So, electrocardiogram is a reading for assessing the magnitude and direction of the electrical activity of the heart. So, it also measures the heart depolarization and repolarization. So, if you say depolarization, it pertains to heart contractions, while heart repolarization, it indicates the heart relaxation. Now, let's proceed to our first procedure. So for our first procedure, verify the order for an ECG on the patient's medical record. Next, gather all equipment and bring to bedside. In obtaining an ECG, we need to have our equipment. So the equipment includes the Ecg machine. We have here the chest electrodes. And we also have here the limb lead electrodes. Connected here will be the limb lead wires. We also have the cordial lead wires. And we have here the ECG strips. So for cleaning the area, we use basin with water and soap. And we also need to have the washcloth, 2 washcloths, 1 for washing and 1 for drying the area. And also, we included the tape to ensure that the wires are in place. And for our personal protective equipment, we're gonna use gloves and also the mask. So for our third procedure, perform hand hygiene and put on PPE if indicated. So after washing our hands, we need to put on PPE. So we have here gloves. Then put on mask. Then the next procedure is to identify the patient. Sir, good morning po. I am Melvina Cario, sir. Your student nurse for today. Sir, pwede pong malaman yung pangalan niyo, sir?
Opo.
Anong pangalan niyo, sir?
Ako po si Luis Sacario.
Okay, sir. Pwede pong makita yung identification bracelet ko, sir?
Opo.
Okay, sir. Okay, thank you po, sir. After identifying the patient, close the curtain around bed. And we need to close the door to the room if possible. So, as you set up the machine to record a 12-lead ECG, explain the procedure to the patient. Tell the patient that the test records the heart's electrical activity and it may be repeated at certain intervals. Then emphasize that no electrical current will enter his or her body. Tell the patient that test typically takes about 5 minutes. Then lastly, ask the patient about allergies to adhesive as appropriate. So sir, yung procedure or yung task na gagawin po natin, makakatulong po siya para ma-monitor po yung heart po natin, yung puso natin, kung ano nangyayari. Makikita po dito kung merong abnormal or normal po yung activity ng heart natin. So, itong test na pong ito is pwede po siyang maulit, depende po kung kinakailangan. At wag ka pong mangangamba, sir, kasi hindi ka po masasaktan sa test na to at hindi po papasok ang kuryente sa loob ng katawan nyo. At itong test po na ito, usual po, nagtatagal siya ng 5 minutes. Sir, matanong ko lang po, may allergy ka po ba sa mga pandikit, gaya ng glue?
Wala po.
Okay po. So, the next procedure is to place the Ecg machine close to the patient's bed and plug the power cord into the wall outlet. If the bed is adjustable, raise the bed to a comfortable working height, usually elbow height of the caregiver. So the next procedure, have the patient lie supine in the center of the bed with arms at the side. Then raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately. Encourage the patient to relax the arms and legs. So if the bed is too narrow, place the patient's hands under the buttocks to prevent muscle tension. Also, use this technique if the patient is shivering or trembling. Make sure that the feet do not touch the bed's footboard. So, sir, sa procedure po na to, kailangan pong makahiga kayo, sir. At lang natin, sir, humiga na po tayo. Okay, sir. So, ayos ka lang po dito. Comfortable naman po tayo, sir.
Opo.
Okay, sir, itong kamay niyo po, arms at the side. So, sir, yung paa niyo po, relax lang po. Okay. Lagay ko lang po ito. Relax dito, sir. So, ilalagay ko lang po ito, sir. So, expose the legs and the arms. So, we just need to expose the area which is needed to be utilized. Okay, sir. So, relax lang po tayo, sir, ha? Huwag kang kakabahan.
Opo.
Okay, sir. Thank you po. Select flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If the patient has an amputated limb, choose a site on the stump. If an area is excessively hairy, clip the hair. Do not shave hair. Clean excess oil or other substance from the skin with soap and water and dry it completely.